webinar. My name is Megan Nicholson, and I'm the Director of Marketing at wellbe.me. We're happy you've decided to join us today for Using Social Technologies to Engage Patients Across the Continuum of Care. A few housekeeping details before we get started. This webinar is being recorded, and you should receive a link to the recording and slides tomorrow by email. Please feel free to share this webinar with colleagues who could not attend live today. A question and answer session will immediately follow the presentation. If you have a question for our speaker, please type it into the questions box in your GoToWebinar panel on the right side of your screen. Today's webinar is sponsored by Wellbe's Guided Care Path. A Guided Care Path is a social technology that helps set proper expectations for surgery by creating a continuum of connection between patients, their families, and their providers. Smart checklists are delivered just in time as patients progress through their surgery plans and recovery. The information is always there for reference when needed in case preparation or follow-up instructions are forgotten. This helps reduce patient anxiety and improves outcomes. To request a free demonstration, just answer our poll at the end of this webinar or visit us at wellbe.me. I'd like to introduce our speaker for today. Christina is Vice President of Social Media at Tower, a patient experience consulting group. She advises healthcare organizations on strategies to engage consumers across the continuum of care and apply emerging technologies to positively transform experiences from the patient's perspective. Christina, I'm going to give you the controls and you can take it away.
Okay, thank you, Megan. And good morning, everyone, or at least where I am, it's still morning. Okay, so can you see my screen, Megan?
It looks good.
Okay, so we'll get going. Let me get this little thing out of the way. So good morning, and we're going to talk today a little bit about social technologies, and I'd like to give you a little bit of background on my perspective. So I come from the world of hospital and clinic operations. I've worked in hospitals over 30 years on the administrative side. And in 2005, I started a weblog, which got me thinking about social media and how the technology, at the beginning it was the channels, but how the technologies could be used to solve some of the challenges I'd experienced across my career. Many of those involved communication challenges. And so this presentation really is a way for me to highlight the opportunities that exist to apply these new technologies to the work that we do in healthcare organizations. Okay, I've got to find my advanced button's not working.
If you click directly on the slide,
I'll do that. Okay, here we go. So we have a couple of learning objectives. We want to look at the contributions of social media, not just for the patients, but also their family caregivers. Family caregivers have a very important role, and we want to also engage them. Oftentimes, they're the ones going online looking for information for the patient, especially if that's an aging parent or perhaps someone who's very ill. So we also want to not forget about those family caregivers. And then also looking for those opportunities, as I mentioned, for using these technologies for clinical and operational processes. So this is a great tweet. I saw it a couple of years ago. It's, I feel the same way about hospital gowns as I do using social media. I'm never sure what I might be showing. And I think that, this is probably a patient who wrote this. I don't know who MS Bluebells is, but I saw it one evening or afternoon on my tweet deck, and just what it tells me is that there is some risk to use of social media and social technologies, and so as we implement these tools, we need to really be cautious. And so this is just a reminder of the caution that we need to exercise when it comes to social media. The definition that I use is that social media is really an electronic tool for communications. the important components of it is that it's at least bi-directional. There's dialogue and collaboration in building content, and most importantly, it's easily accessible anytime, any place. It's really a ubiquitous kind of technology. So there's a distinguishing, I need to distinguish between social media and social technologies. So I consider social media to be the branded tools that you hear about: Facebook, Twitter, Pinterest, Foursquare, any of the other social channels that are out there that are popular that people are using. But behind each of those brands is a technology. In the case of microblogs, that would be Twitter, Instagram, and several others. So this is just a little bit of an outline of some of the different technologies that I will be talking about and incorporating in the presentation. The eHealth Collaborative has a framework that they came out with last year, and we at Tower had been using a sort of a framework in our work with clients that really fit well in what they did. So I combined the two together, and this participatory model really kind of shows where social technologies come into play. So historically, we've had public websites. They're very static. It's all about pushing information out to consumers. Then we get into the adoption of electronic medical records, and some organizations are getting their patient portals up, and that's really very transactional. I go on, I look at my lab results, I maybe message back and forth with my doctor. I'm being engaged, but it's really not where we need to be going forward in healthcare. Then we get into a patient-empowered portal, and that's where we start really getting interactional and having self-management tools available. And this is where these social technologies come into play. Beyond this, we get into interoperability and health information exchange. So social media across the care continuum, we'll be talking about this this continuum up here a little bit later as we go through some specific examples. But these are the patients, the consumers that we need to be thinking about. Those who are the worried well, they're new to town, they're looking at maybe selecting a new hospital, selecting a new physician or clinic. Maybe they're newly pregnant and starting to think about pediatrics. So this is providing information and tools for that population. And then we get into pre-treatment, which is, I know I need to go in for surgery. I'm going to have some kind of therapy, getting that onboarding process completed. The active treatment phase, of course, which is definitely the inpatient period or phase. And then most importantly, the post-treatment. Oftentimes in healthcare, historically, we have sort of wheeled that patient up to the front door and waved goodbye to them and said, come back again if you need us. We can't really do that anymore. We have to have some kind of ongoing connection with them so that when they do need care again, they come back to us. And when they do come back to us, they really are in need of care, that we've supported them after they've left the organization. So we'll talk a little bit about some of the drivers. So one of the big drivers is patients prefer health provider social networking sites. They really also would like to see an integrated approach. They don't want to sign on to the patient portal in one place and then have to sign on to social networking sites in another place. They really would like to have those two integrated so that there's a seamless connection and navigation between the two. They've also said that they think that hospitals with social media connections would strongly affect their decision to receive treatment at a facility. And one of the stats that I'd seen that I thought was really, truly amazing, and this is actually about at least a year old, is 81% of patients felt that a strong social media presence meant that the clinical functions of the organization were cutting edge. So it's a perception, but oftentimes perceptions are reality, or at least the realities that we need to deal with in healthcare. There was some other studies, and this was across all industries, and what they found was that there is a link between the customer experience and online satisfaction as well as financial success. They found that visitors were more likely to return if they were satisfied, use the information that they found as a primary resource, and when they looked at the specific hospital and health systems category, the hospital and health system sites ranked a 74 out of 100% scale. So, that shows us right there that there is some room for improvement. So why are we talking about social technologies as part of the care continuum and for care processes? So here's a little snapshot of what's going on in the healthcare climate right now. We have new payment models. We have population health. How are we going to reach out and engage large groups of patients and consumers to stay healthy? We have the importance of patient satisfaction, quality and safety penalties that are being levied by CMS and probably soon other insurance companies, and accountable care, integrated delivery. There's a lot going on in the healthcare climate right now, which is making social technologies a bit attractive as solutions. So we mentioned the EHR a little bit earlier, and the patient portal. Unfortunately, the EHR's patient portal can't anticipate every question that a patient or a family caregiver might have. Most of the information that is contained in patient portal, the educational information, is written at too high of a level for most people to understand and act upon. And that's particularly important for the 77 million people with a poor understanding of basic medical vocabulary and health concepts. There was a study that looked at the physician interaction with patients in an exam room. 37% of the physician's time was spent on patient education, yet patients were failing to report their problems or their most important healthcare problems. And another study showed that 80% of patients discharged from an emergency department didn't understand their home care instructions. When you look at caregivers of young children, one of the things that makes social technologies very attractive is the multimedia aspect and the use of visuals. So this was a research study that looked at mostly parents, but caregivers of young children who were making dosing errors. When they implemented this pictogram, and they had a couple of different ones, but this is just one example of them. When they implemented the pictogram, they felt that the problems with error rates and adherence to all of the instructions that were provided dropped. And social technologies are also really good for evidence-based communication. So those of you whose organizations are implementing things like team steps, you can look at social technologies as helping to incorporate the patient as part of the team, and abilities to help advocate for the patient, whether it's the family caregiver or the patient themselves, engaging patients, closed-loop communication. Social technologies are very good for having closed-loop communications, which can be documented, and then also facilitating those important handoff processes. So here in California, there's a goal to reduce readmissions by 20%. And when the state of California looked at what was driving readmissions, they found several things that really speak to the need for social technologies. The first was lack of engagement or activation, ineffective or unreliable sharing of relevant information, and patients not understanding or not correctly taking their medications. The causes for the readmissions are listed here. And they found also that 51% of the discharges did not have timely follow-up within 30 days. And that population is 10 times more likely to be readmitted. So it's really important to have a way to keep connected with those patients after they're discharged from the organization to ensure that they're not readmitted within that 30 days. And so here we'll start talking about some of the more specific examples. Again, what we're really focusing on is making sure that information is available for patients when the questions arise. It's not always going to be in the exam room. It may be the night before the surgical procedure or the treatment that's coming. The patient's trying to prepare themselves. They have questions. And sometimes when all they're relying upon is handwritten notes based upon a phone call from the nurse who gave them instructions, they're going to have questions about did they write everything down correctly, are they doing what they need to do. The information needs to be relevant, contextual, and focused in on their condition. And patients, again, would prefer to receive information from their provider rather than having to go out and scour the internet looking for information and worrying that they're not selecting information that's accurate. And these tools need to be user-friendly. They need to be patient-centric. It needs to be something that patients and their family caregivers can really use and apply to meet their needs. So the first thing we'll kind of cover are some apps. Apps are really popular now that smartphone use is really widespread. If you go into a phone, you know, Verizon, AT&T, whatever provider you're using, you're not really seeing any phones anymore out there that aren't smartphones. So apps are a huge opportunity. There are a lot of apps that are focused on different types of healthcare needs, but the two top consumer apps right now are on weight loss and exercise, and these are the ones that are downloaded most often, and there's more data in them. But when you look at the actual use, the population that's really using these apps on a regular basis is those who are using it and for questions and issues related to pregnancy. This is just a little breakdown of some of the different types of apps and the percentage of use. So pre-treatment. Here are a couple of examples of social technologies being used for that, you know, before you're coming into the organization for some kind of a treatment. So Floyd Medical Center is in Georgia, and a lot of hospitals have moved to using video, but Floyd has a preoperative patient guide. It reinforces that phone call that the nurses may make to go over the instructions with the patient by making that video available not only on the hospital's website, but also on YouTube. So patients of Floyd Medical Center can use that video to refresh their memories of what they need to do before a surgery, but really anyone who's across the world could also access that video and watch it as well. Another one is preconception assessment. So Gabby is a virtual avatar, and she takes patients, these are consumers actually. They're young teens who are at high risk for poor reproductive health and family planning outcomes. There's low literacy level issues in this population, and she provides relevant contextual communications based upon the responses that these individuals provide. Pre through post-treatment here in California, or actually I think Columbia Valley Community Health is up in Washington State. They reach out to and communicate with young immigrant and underserved mothers-to-be using a social networking platform, and the same with West County Healthcare Centers. They're using a social networking platform to eliminate some of the social stressors of the barriers for care, to help these individuals in the community access condition-specific educational content, and also help those patients who need to help to manage their chronic conditions. Another use of a virtual avatar, and this is actually was an avatar that kind of led to Gabby, the one being used for preconception, is Louise. She's been created by Boston University. She's a discharge advocate. She takes patients through the discharge process. It has reduced the amount of time that the live discharge advocates are needing to spend with patients, and patients actually prefer using Louise because, as one patient said, if I didn't understand something, I could replay it over and over. Sometimes nurses and the doctors were in a hurry, so I enjoyed using Louise, the discharge advocate. It encourages patients to be real active participants in their care, and in this case, it's shown a 30% decrease in emergency department and hospital utilization. Treatment and post-treatment phases. So this is while patients are going through some kind of a treatment process or after they've been discharged. Northern California Healthcare Centers are using, this is a rural area of California, they're using this private social networking platform to extend care outside of the visits to the clinic. So patients are able to help participate in the management of their chronic diseases. They're also using it to engage patients outside of those visits to get them to come back again when the time is needed for them to come back for follow-up visits. United Healthcare Centers of San Joaquin, a very agricultural area, a safety net provider, also using both the online and a mobile platform for providers and patients to jointly manage chronic diseases. And then Children's Hospital of Dallas has a secure online social networking communities. It was actually the idea of the mother of one of their patients. So this was an idea that came directly from the patient population, their needs to communicate and support one another. It started with a very small population that had some very strict dietary needs, and it was a good way for the parents to communicate and share ideas and best practices. It's now since expanded to all former and current patients and families. They can personalize settings. They can join different kinds of groups. So if you have a heart condition as well as diabetes, you can join both of those groups. It's a real great opportunity for engaging both the current as well as the former patients and their families. One of my favorites is a social networking platform, and so this is a platform that is secure for those recovering from addiction. So we know that mental health and chemical dependency are some of the diagnoses that have the most strict confidential and privacy regulations around them, but they're using this social platform. It's available to patients or those recovering from addiction as part of an aftercare plan or ongoing recovery, 24 hours, 7 days a week. So if the individual is feeling like they're needing to use again at 2 in the morning, they don't need to wait until that 7 o'clock a.m. Narcotics Anonymous meeting. They can log on online, connect with people, and hopefully, not relapse from their recovery process. So what they found is that the case managers are using this platform. They communicate with the patients or the consumers who are in recovery. They're able to track their behaviors. Their patients are self-reporting how they're feeling on a daily basis. They can filter that activity and identify those patients who are at highest risk for relapse and intervene with them much sooner in the day. One health plan has realized significant reductions in their relapse rates and also readmission rates. And again, it's available anywhere, anytime for support with an app on a mobile device. This is just a list of some of the different results that they've identified. This payer, both hospitals and payers are using this with the recovery communities that they serve. But these are some of the results that one of the payers has realized in their particular program. Survivorship. So another example is Boston Children's Hospital using social media to augment their traditional surveillance methods. In this case, it involved children with hypoglycemia with their diabetes. They used the social platform to expand knowledge of complications among this population of children. And they also listened to the communications that were going through by the kids participating to identify information that could flag or at least let them anticipate the activities that led to a relapse. So it really, what they found was that it really had an impact on the behaviors of the individuals and also gave the researchers some insight into what might be going on earlier in the process before patients wound up in a situation where they needed to come in for emergency support. Social media, I mentioned smartphones earlier. Social technologies are definitely extending to mobile. And while some, question whether texting really is a social technology or not, I think whether it's texting or using a microblog to send messages, one of the realities of texting is that 90% of text messages are read within 3 minutes. And this is why some of the texting examples that I'll show in a minute are so powerful. And they're very powerful, especially among the young, minorities, and Medicaid beneficiaries. We do have Text 911 now available in some markets. That's expanding across the country, and that in and of itself, I think, is a sign of how powerful texting communications will be as we go forward. Bandwidth is on here because the importance of it is that a 1-minute phone call uses the same amount of bandwidth as 800 text messages. So when you need to really get a large communications out to a large group of people or a population, it's a very efficient way of doing that, especially if you're in a community where bandwidth is at a premium. And that would be very small, rural, remote communities. So in this particular example, these were adults with diabetic issues who visited a public emergency department, and participants received 2 text messages daily during a 6-month period. These were some of the things that were listed. There were trivia questions, medication reminders, and what they found was that the blood glucose levels fell, self-reported medication adherence increased, these patients visited the emergency department less than those who weren't part of this text messaging program. And they also felt that the effect on medication adherence and disease control was higher among Spanish-speaking individuals. Again, some of the populations that are historically underserved are easily reached through these mobile platforms because their smartphones, their mobile phones, are probably the only internet connection that they have. Overall, 93.6% of patients who were sent text messages said that they enjoyed receiving them. So if we look at patient satisfaction, the patient experience, it's a way of communicating with patients the way that they would like to be communicated with. Partners Healthcare in Boston has done a lot of work around texting. There are several studies. Some of the outcomes that they've identified are patients feeling better connected to the care team, improving adherence to care plans, decrease in no-show rates. This was found especially among opiate addicts who had very important follow-up appointments, and high-risk pregnancy patients that they had, and they had also documented sustained behavior changes. One of the text messaging programs that they did was Sunscreen Use with a high-risk adolescent population. And on this graph, you can see those adolescents who were part of the reminder group, getting the text reminders to use sunscreen, kept their sunscreen use up, while those who didn't receive the reminders dropped off dramatically over the study period. So at the very start, I talked a little bit about managing the threats and risks of social technologies. One of the first things in thinking through the process of applying any of these tools is considering the fact that we all have a different language in the social world. I may be on Twitter and Facebook. You may be on YouTube and Google+. So as we look at opportunities to leverage these tools, we really do need to think through the population that we're trying to reach out to and connect with them how they're connecting to other people. Social media is about learning and influencing. This is an opportunity for healthcare organizations to really listen to what people are saying on social channels, to identify their attitudes, what they think about your particular healthcare organization, their perceptions of your healthcare organization, and their behavior about your brand and trends. So while social media has really started in healthcare organizations in the marketing and public relations department, it's one thing to push information out, but it's something very different to listen to what your constituents or your consumers are saying on those social channels. Social intelligence is a way of collecting what people are saying out there. In the old days of healthcare, we used to have newspaper clipping services that would clip out articles every time our hospital was mentioned in the paper. These social intelligence platforms really scour social channels to see what people are saying on blog posts, on Twitter, on whatever social channels are out there. And then there's some social customer relationship management, which is really identifying the ways that your customers interact with your organization and taking that information to learn, as I mentioned earlier, how people are communicating online on social channels. And social is really just a new form of the word-of-mouth promotions. So consumers of healthcare services are not afraid to go online and share their thoughts about their experience with healthcare providers or health insurers. This is a nice graph that shows that people are going online and sharing their experiences, both positive and negative, and this is why it's so important to listen to what your community has to say about your organization on social channels. And what are patients sharing? So with the exception of the last bullet, this is a list of what patients of one of my client organizations had to say. And in this particular case, the organization didn't realize that these were comments that were being left on Yelp and Foursquare about their particular organization. The last one was actually, I made a presentation earlier this year, and one of the hospital CEOs in the audience shared with me that there was a YouTube video of a staff member brushing their hair at the emergency room desk. A patient who was waiting in the emergency room, getting frustrated because it was taking too long, took a video of this one staff member brushing the hair of another. Unfortunately, they didn't realize that the two staff members were off duty and they weren't working, but it really looked bad for the organization. So you really don't know what your patients are putting online on social channels unless you're going on there to see what they actually have to say. So push content and listen. Again, reinforcing the importance of sharing information online, but my guess is this particular physician probably stopped eating salami for his lunch so that he could maybe minimize other young patients from making comments about how he smelled on their Twitter post. Some related patient-centered technologies that fit really well with social. I've mentioned mobile technologies, enterprise portals, which provide that opportunity for a single sign-on proxy access to both the electronic health record as well as any social technologies or even other patient-facing systems that you have available. And the importance of personalization, making information that's going out to patient populations contextually relevant and informative. And if it helps to think about it as the Amazon.com experience, you know, that's what personalization is all about. Every time you sign on to Amazon.com, they know what you've done in the past. They know what books you've looked at, what movies you've looked at, what you've ordered online, and based upon that information of your history in the past, they present things to you that you might be interested in going forward. And so patient experience improvement is a process, and if you look at use of social technologies for improving the patient experience, it's a process as well. And what we found is that the most effective strategies are those that bring together the people in operations, the clinical leaders, the marketing, as well as the information technology people to create those strategies that really will address the needs of the patient population, the employees of the organization, and also help move the organization forward by solving some of the operational challenges that they have going in the organization. So the best positioned hospitals are going to be those who offer the social engagement opportunities, and these are best positioned going forward as we look at a new healthcare delivery system, making those who have real user-centered designs. Unfortunately, there are a lot of apps that are launched, and they're so frustrating for the users that after they're downloaded, nobody ever uses them again. So it's real important to make sure that whatever your design is really fits with how the patients or your consumers need to be using it. You'll benefit from the resulting patient perceptions. You'll find new ways of facilitating care coordination processes. And really, it's about looking at the way care is provided. And we need to change that way that care is provided. The traditional delivery mechanisms aren't going to get us where we need to go in the future of population health. And social technologies provide us an opportunity to really change the way that we deliver the care that we need to deliver. And so that is all I have to present. So I'll let Megan open it up for questions, and I really appreciate everyone participating today.
Thank you, Christina, for that informative presentation. We are going to open it up for questions. First, we're going to ask all of our attendees a question. We would like to know, has your organization started using social technologies to engage patients yet? And let us know if you're using them extensively, you're using them, but you're not quite sure what you're doing yet, or you haven't started. Everybody get your votes in, and we'll show the results in just a few seconds here. If you have a question for Christina, please type it into the questions box in your GoToWebinar panel on the right side of your screen, and we'll get into those next. All right, let's show the results here. And it looks like 25% who say they're using it extensively, 33% say they're using it but they're not quite sure how to do it, and 42% say no, we're not doing it yet.
It's some interesting statistics. So that's the opportunity is to think through the challenges that you have in your organizations, and maybe how some of the different technologies that exist can be that solution that you need.
Great. While everyone's submitting questions, I wanted to remind everyone that this webinar has been sponsored by wellbe.me. Wellbe's guided care paths are a social technology that helps set proper expectations for surgery by creating a continuum of connection between patients, their families, and their providers from before an acute care episode to post-op follow-up. Smart slips are delivered just in time as patients progress through their journey. The information is always there for reference when needed in case preparation or follow-up instructions are forgotten. This helps reduce patient anxiety and improves outcomes. If you'd like a demonstration, a pre-demonstration of our social technology here at Wellbe, please just respond to the poll currently on your screen. All right, let's see if we have some questions here. I want to ask if we can get a copy of the presentation, and yes, this has been recorded, and you're going to get a copy by email tomorrow. Christina, how do you address the communication fragmentation in healthcare? Is there a single place for all healthcare communication to occur?
I don't know that there ever will be a single communication, because we've never really had, we've had snail mail, we've had the phone, we've had email, we've had fax machines. I think, when I talk about channels, we all have our preferences. I'm on Facebook and LinkedIn and Twitter and Pinterest, but I'm not on Google+. I had a user experience where I just couldn't log on. So for whatever reason, I can't be on all the channels. I'm sure we'll see some narrowing down, but I don't know that we can anticipate that there's one communication channel. And again, it really depends upon the patient population or the purpose. It could be a communication channel that you're using a social technology for internal communications. A lot of chief information officers would love to reduce the number of emails going back and forth within an organization. And one way to do that is to implement some kind of a social platform as part of your hospital's intranet. So I don't know that we'll have one, end-all, be-all social platform, but I think we'll still have multiple, just as we do today, because we all have our preferences to how we like to communicate.
Great. For the 42% people who answered the poll that they haven't started yet, what might be an easy first step or the best way to get started?
Well, I think, again, I come from operations and, continually trying to improve the performance of my organization or specific departments. I would start looking at the performance improvement data that your organization has. What are the priorities that you've already identified as needing an improvement? And are there opportunities to use a social technology to help contribute to improvement in that area? So for instance, I had a client organization that I was working with, and I was speaking with the lady in the surgery department. And one of the things that she told me was they send these are patients who are typically referred to this hospital after not having successful treatment elsewhere. So they're referred to this organization for the specialists, and they receive this binder of information to read before their surgery to prepare. And she said, unfortunately, many of the patients are traveling from out of town and don't receive the binder at their home until after they've already left to come to the hospital for treatment. So here's somebody at the hospital who spent all this time putting this binder of information together. They're paying for it to be shipped in the mail somehow, or UPS or FedEx, and then it doesn't get there in time for the patient and their family to actually use the information. So how can we make that information available on a more timely manner? And that could be putting things in video format, making them available on either YouTube if it's something that's open for the public, or if it's a particular, you know, a sensitive kind of condition-related piece of information, making it available on a secure portal for the patients.
Well, that's all the questions we have for today, so I'd like to thank everybody for attending. If you have questions you didn't have a chance to ask, you can feel free to email them to info@wellbe.me, and we'll be sure to get back to you or connect you with Christina. Everyone watch your email tomorrow for a link to the recorded presentation and a PDF of the slide set. Thanks everyone again, and have a great day.
Thank you.